Welcome to the Psychology Club podcast, brought to you by Vicente Martinez High School.
Hi everyone, welcome to the Psychology Club podcast. Today I'm your opener, Ian King. Today we are talking about what we want to see in the mental health support for youth. Carla, take it away.
I say we have more diverse research studies because most of the studies being done are usually about white men. And the world is more than just white men, so I think we should just do more studies on different racial groups, different ethnic groups, different communities, stuff like that, to get a perspective on everybody, not just white men. Yeah, that's it.
I'm Salem, and I think there definitely needs to be better treatment in mental facilities and psych wards for patients. As someone who has been in those facilities and someone who knows people who have also been in those facilities, I hear a lot of horror stories. A lot of staff in those facilities don't treat their patients like humans. And so I think that definitely needs a lot more improvement, as mental facilities are supposed to be a place for healing and not supposed to cause you even more trauma than when you already get something.
I'm Nikki, and I think there should be more diverse providers, such as more inclusivity with race, gender, and sexual orientation. Because according to Zipia, the main demographic is white, with a 76.4%, and a very low minority rate with Black or African therapists. It's only at a 4.1%. So there's very little percentage of people who are part of those groups, so they can't really relate to the therapist at that level.
Hi, I'm Victoria, and I believe that schools should have a bigger support system, and I feel like they should talk more about mental health, because I feel like they don't as much as they should. And yeah.
Hi, I'm Caleb, and I feel like it should be easier to get mental health care for youths because it is important.
I'm Kylie, and more cost-efficient meds and therapy should be free because they should be free.
Okay. I'm Alex, and I'm gonna just say, I think that a lot of times you need a safe space to be able to figure out your identity. And while therapists are often really understanding, they can also be bigots, but they can also get locked in on what you call yourself on your first visit or your second visit, or whatever visit you start feeling comfortable talking to them. And I think it's really important that therapists learn to ask the hard questions in a way that doesn't make youths feel uncomfortable about their identity, so that they can figure out what labels they're comfortable with.
I'm Mia, and I think it's important for there to be confidentiality between you and a counselor or therapist, because there's no trust built on that. It's important to trust the person you're talking to.
I'm Alyssa, and I feel like parents need to stop stereotyping their kids when it comes to their mental health, because there are lots of stereotypes, and parents immediately kind of go to those stereotypes when their kids ask for help. So I think parents really need to understand and learn about these stereotypes and learn more about their kids, so they know these aren't stereotypes anymore. Your kids actually need help, and they're not just insane.
Thank you everyone. That's all the time we have today, so bye.
We love you.